Hello and welcome everyone to our outstanding celebration day. I'm going to smile a bit this time. I was told last time I didn't smile enough, and this is a real opportunity for us to feel very pleased with ourselves as an organisation. Why have we got an outstanding rating? Firstly, and most importantly, it's down to all of you. It's down to the culture that you create, the attitudes that you bring to work every day, and the fact that you focus on our patients and our service users relentlessly, the fact that you work fantastically as a team, and you all care. You all care about the organisation, but more importantly, you all care about the people that you look after, but also the people that you work with day in, day out. So I really hope that you enjoy this celebration. It's start of a campaign for me to focus more on the well-being of our staff so we maintain this status.
Being fairly new to the Trust, the first thing I noticed was how friendly the staff are, and they go above and beyond for patients and families. Working as an admiral nurse within the Trust, it's highlighted how passionate the staff are in terms of dementia care and how the Trust is fully committed to providing the best quality care for patients and their families affected by dementia.
What makes this an outstanding organisation is the fact that we're here 24/7. We coordinate all the clinicians and the patients get to the right departments all the time. Not only that, we
haven't had
have
any
to activate all the emergency procedures. Because we're here 24/7,
as far as we're aware, if it's
we're
fine,
in charge of all
we
sorts of
just
other things
phoned
apart from
through because obviously
switchboard.
several people came to the window as
Make
well.
sure that patients
We haven't had any
come to the
alerts
window,
for
they
major
get directed to the
hemorrhage
right
at all, so
places.
that's nothing to do with it.
We have a huge number of volunteers here at Warwick Hospital and across the Trust. We have getting on for 400 in various capacities. We have ward volunteers, dining companions, activity volunteers who play games with patients and do activities. We also have help desk volunteers who sit at the help desks at the main entrance and outside outpatients, and they direct visitors, people who may be panicking about getting parked, getting to an appointment. So we have around 50 volunteers doing that. We also have a League of Friends bric-a-brac shop and a bookshop, and that brings in around £12,000 a year. And we also actively fundraise with the League of Friends to purchase equipment, sometimes vital for Warwick Hospital.
I work for the Community Children's Nursing team, and as part of that team we look after children with life-limiting and life-threatening conditions. We're all about ensuring that we look at the outcomes of the children, what is it that they want to achieve, and how can we work together as part of that multidisciplinary approach in order to make sure that those needs of the child and young person are met. And that's working with health, social care, going out and visit them at home, schools, different environments, and looking at how we can support and make sure that all of their needs are met through their outcomes.
So one of our close specialists, Tracy Lowell, wrote this story for one of the patients to help her through her journey from diagnosis through to receiving treatment, and parents had fed back really well about it, and the child loved it. So we approached the Royal Dahl Foundation to support the development of the book. So Super Steve, and he has a change of cape I think, and then there's a little girl called Super Susie.
So I work for Warwickshire 0 to 5 Public Health Nursing Service, and health visiting in general across Coventry, Solihull and Warwickshire. There is a real focus on working with parents and families to support them with their transition into parenthood and preparing their children for school. It involves helping support them with making sure their child grows, develops and thrives in the environments that they're in. We visit parents and families within their own homes. We work with other partners and other agencies, including the Children and Family Centres and hubs and community centres, to try and see families where it suits them.
I think the staff on this ward are really passionate about making sure that they provide patient-led and centred care to all of the patients. They have a varying level of dependencies on here, and I think they are really passionate about making sure that they care for them in a way that they would want their loved ones to be cared for.
Teamwork, and people enjoy working down here together.
Yeah, we're just great team. We love working here. It's every day we come to work, we're always happy. You couldn't work in a better place. Fantastic.
Yeah, I think it's about all disciplines working together, not just doctors, nurses, paramedics, physios.
Well, I think here in A&E we work as a team, and that makes us working better, reducing the waiting time and seeing patients quicker. We work together with consultants, with all the staff nurses, with the porters, with the cleaners, and that makes a really good environment for the patients and the staff.
When we got roped in to support the out-of-hospital diabetes pathway, the first thing that we need to acknowledge is the foresight of the CCG to actually fund Helen,
the community,
and the two admin people here to enable us to do something that we previously didn't do, which is really support the community dependent patients proactively by engaging with them both at their homes and in the care homes, and often engaging with the district nursing team who actually tirelessly look after them day in and day out. And that support enabled us to actually go upstream to the problems that could surface, and previously these were coming to our attention when they came into hospital, whereas now they had a window to actually engage with the specialist and get their remedy put in where possible.
I think working in this organisation there's quite a lot of dedicated professional people. Everybody's committed to the job and supporting each other, also doing the best for the patients. So I think we do things above and beyond. We do quite a lot of little initiatives that piece together, they make a good patient journey. We work with the West Midlands Fire Service to get the hospital to homes, to get our frail and elderly patients back home quicker. And we've done a collaboration with the WASPs, the rugby team, about getting them in and getting them their focus and involvement in our frail elderly patients.
As an organisation, I believe we're outstanding because of the care that we give to our patients and also how we look after staff. So an example being on the Elsford and Rigby units, we really care about our staff firstly because it's our staff that provide the care to our patients. We have a philosophy where we insist that we make our every contact count with our patients, and so whether the patients are with us for an hour, a day, a week, a year of their life, we believe we try and make that positive difference.
It's been absolutely amazing. I'm just coming to the end of the second round of chemotherapy, and the staff, they work so well as a team and they're just so professional, but they're all such caring people. I've got nothing, well, I can't express what I think about them. They're wonderful. They're wonderful.
I think the main thing is that we have a really cohesive department made up of engaged clinicians, really supportive management, and the whole multidisciplinary team made up of all the nursing staff on the ward and the support staff that make the environment to work in enjoyable, and that means that people remain engaged.
I've had excellent care. From the time you walk in, everybody's been so nice, even down to the food. The food, I've had a wonderful dinner today. It's been very nice, and even down in the operating theatre, everyone is so good, and up here, they really are marvellous. I've got no complaints at all. It's really been a good experience. Well, not that you want to come into hospital, but it's been a good experience.
Everything was good from beginning to end. It's really good. No complaints.
Well, this is the third time I've been, and each time has been exceptional. You have great confidence because you know that they know what they're doing. They're very efficient, they're very helpful, and they're very friendly, which for me is actually most important. And that's everybody, from the surgeon down to the lady who came and did a bit of dusting. They chat, and if you ask them a question, they'll tell you. And if they're not sure about that question, like I asked what time's visiting, and they say, oh, I don't know, I'll go and find out. So even simple things, I have great confidence.
I think it's the way we work with our patients. We work with them, we involve them in their decisions about their health, what they want to do. It's about the way we work together as a team, because that's really important. We share the burden. If someone's really, really busy, someone's not, we'll help each other, and we'll basically come out with something that will help the patients at the end of the day, because ultimately that's our main concern.
part of what makes us outstanding is as a team we start to identify as soon as staff kind of get inducted and settle down in the role, staff progression. So, you know, I look at people and think they'd be really good going into leadership, or their clinical skills are outstanding, and then we kind of identify a pathway for them to follow, or their end of life care. Recently I've had a Band 6 become a clinical practitioner, a Band 6 become a professional lead, and staff go to the end of life care team and get promoted. So I think that's one of the things that makes us outstanding, is the career progression.
So I've just joined the district nursing team about 3 months ago, and I came from the ambulance service, so it's quite a change, but still in healthcare. I really enjoyed this job. I actually enjoy it much more than my previous job, which a lot of people are quite surprised at. But despite what people say, I think it's actually a really relaxed job, and we have a lot of independence, a lot of freedom, and just get to make a difference every day.
Oh, I'm very happy working here. I think the trust offers good opportunities for everybody to develop. I just finished my prescribing and I'm prescribing now.
So with my role, I was professional lead when CQC for all the preparation for it, and I managed a community team within Warwick and Kenilworth, as well as the leg ulcer service in the south of the county, and it was about bringing everybody together and really encouraging people to showcase their expertise, their amazing skill set, their teamwork and their development within the trust. And we worked really hard in making sure that was really popular. It's very difficult out in community. You have to be well time managed. We get a high acuity of patients with all different complex needs. So it's a great variety service, and we do an amazing job to provide that holistic care to patients. And sometimes we're the only people that they see. We make a massive difference to their lives. So this CQC providing us with an outstanding is just amazing to our service.
And but as I said again, you couldn't wish for a more caring team and nice hands-on.
I think what makes us an outstanding organisation is the team that we have working here. We're so lucky to have the excellent team that we do. We're quite close-knit, and we're able to offer our patients really centred care and always offer a holistic approach as well. And it's a real privilege to work for such an outstanding trust, because the patient is always our focal point, and we have quite an extensive multidisciplinary team because of being a rehab hospital, so we all have to work together really well, and it is very integrated to try and get sort of the most seamless, continuous care for each patient.
For me, district nurses is going into patients who might be really isolated, so actually we're the only ones that they see all day. So it's about going in there, not just for the health, but also their well-being, and having a look at the bigger picture. Like, we work with other organisations, social services, so it just makes us one big team.
So for us in North Warwickshire, what makes us outstanding is our rapid response overnight service, which is a blended approach with Mary Ann and ourselves, providing end-of-life care for our patients, relatives and homes overnight between the hours of 8 PM and 8 AM when there aren't really many other services available. So at the most vulnerable time, the overnight early hours of the morning, we have a rapid response service that will respond to that telephone call from patients, as I say, carers or relatives, just to provide support for our end-of-life patients overnight. And some of the measures and what we've reported to CQC really is the impact this is having on our patients and their families, the positive feedback we've got from nursing home, residential homes, 111 primary care about how their patients feel really supported overnight at that vulnerable time when they're during sort of meeting the end of their life really.
It's been an absolute privilege to work alongside Debbie and all her team, really making that difference to people when you don't get the chance to go back and do it again. One mistake at the end of life, you don't get that second chance, and we know that we have truly made a real difference to people.
We have great leadership and we have great vision, and the fact that we are an integrated organisation just breaks down so many boundaries. You know, the fact that I am equally known in our acute as well as in out of hospital. I have responsibilities on the acute as well as out of hospital. So what that does is that allows the boundaries to be broken down and for us to progress at speed. Whereas I know in other organisations, some of the changes that we want to make are slowed down so much. But having that engagement as leaders and having shared objectives, I mean, it's great that, you know, we have to have combined objectives, so we have to go and deliver what we want to deliver in out of hospital will have an impact on our acute colleagues, but we work as one because we're one organisation. We've got a fabulous workforce, they are so willing and up for change and to give it a go. I think we do loads of PDSA cycles, which I love, and the beauty of PDSA is that it gives you permission to pull back. So actually listen to the staff. If it doesn't go right, if it doesn't go well in that you know, PDSA cycle, pull back, give permission. And the staff love that. The amount of PDSA ideas that staff come to me with, and I go, let's just go with it. I think also what helps is having that senior support in these areas of change. So we give staff that permission to stop it. It's not working, let's not stress. Let's just stop it. And that whole culture that we have as an organisation to give people permission, let's just stop. So we embrace change, we embrace innovation, and I think what we do is we allow that innovation to, you know, to surface, and we really encourage in that. So yeah, so that's why I think one of the reasons that we've got outstanding is we were clearly able to demonstrate that within out of hospital.